Welcome again to the Quality Reviews webcast. It is a distinct pleasure to have Sonia Panigrahy on today. And before we get started, for those of you who don't know who Quality Reviews is, we are a business that helps health systems collect real-time feedback from patients for the purposes of improving patient experience. So having said that, Sonia, welcome. Sonia Panigrahy is the Senior Director of Clinical Excellence and Innovation at Community Healthcare Association of New York State. So welcome, Sonia.
Great, thank you. Pleasure to be here.
Well, we really appreciate the time. If you could, I'd love to just hear a little bit about your background and how you got to where you are now at is it called Cheney's?
The acronym is Chicanis.
Chicanis.
Yep.
So I'd love to hear a little bit about how you got to where you are now on your journey, and then we'll take it from there.
Sure. So again, thank you for the invitation to chat with you today. So I'm the child of Indian immigrants, and just in terms of some personal background, my parents had their parents die prematurely of preventable diseases: cholera, malaria, diabetes, heart disease. And so my father always instilled in me as a child the importance of healthcare. And he said the most important thing that we can all do is protect our health, because without our health, nothing else in life is possible or easy, such as having an education or having a family. So I really took that to heart, and I decided I wanted to make my career in the healthcare industry, but I did not want to be a clinician. And so it took some time to realize that there was this field of public health that really caught my attention for being able to make healthcare changes for vulnerable populations at a system level. But that's a graduate degree. And so for undergrad at the University of Iowa, I studied economics and global health, and then went on to University of Columbia to study. I got my master's in public health, but with the focus on healthcare management and policy. And at that time, quality improvement was not really standard course material. It was a seminar. But it's caught my attention as something that would be useful and maybe aligned with my interests. And then I took that a little bit further and did an internship at a large hospital in New York City, trying to understand why pediatric ORs were 3 to 4 hours delayed. And I really started to appreciate the complexity of what it takes to get a health outcome to be optimal. And oftentimes when we see a poor health outcome, it's multifactorial. And those factors, or what we call root causes, are in so many different departments that often do not coordinate or speak to each other, that kind of lead the process to break down in multiple steps. And those root causes are also both technical and both human. And it takes a person to understand how they need to connect. So again, all the different root causes in different departments, and then again, those root causes that are human and technical. And so for me, that kind of, the light bulb went on, and I realized this is what I really wanted to do as a professional in the healthcare industry. So I've worked in QI departments in hospitals, but I think the pivotal moment was working at a large federally qualified health center, where I ran my own performance improvement department, and quickly realized that the traditional QI tools in healthcare are often for hospitals. They've been derived from manufacturing, and they work in some processes, but for community health centers where you're dealing with providers, medical assistants, and patients, you really have to have more flexible methods to identify and solve problems. And
Got it.
Yep. So I
No,
work for
great.
a care association that oversees all of these FQHCs in the state of New York.
Okay, fantastic. So in reading your background, you have a lot of experience and expertise in what they call human-centered design. And honestly, I'm not that familiar with human-centered design as a concept. So can you walk me through kind of just a very, very brief crash course into what human-centered design is, and how does that integrate into your work, at the overseeing some of the FQHCs?
I love that question. When I was working at the FQHC, I had not been exposed to human-centered design. I learned about it after the fact, as I was working as a consultant. And uh, we were trying to understand, I was working with a physician and a Harvard med student in Cambridge, trying to understand why patients keep going to the ER. We call them high utilizers, or I think inappropriately frequent flyers. These are the patients who go to the ER 4 times or more. And what